Hello, and welcome back to Mammalian Anatomy at Keuka College. Currently, we're talking about chapters 19 and 20, and in this video series, we're focusing on the anatomy of the heart and blood vessels. In this video, we're going to look at the structure of blood vessels. Specifically, what does the blood vessel look like in cross-section? And we're going to compare the cross-sections of an artery and vein. Remember, arteries are going to carry blood away from the heart, while veins are going to carry blood back to the heart. And so they're going to be structurally different from each other, and that structural differences is going to be important for the functions that they serve in the body. So let's look at the structure of the blood vessel walls. So arteries and veins are going to actually have three layers: tunica intima, tunica media, and tunica externa. And so we can kind of see them over here. This area would be representing an artery, and this area would be representing a vein. And here we have in blue, or this purplish color, the tunica intima, the deepest layer. It's going to be the closest to the lumen, or that hollow space. Tunica media, which is going to be in the middle, and then the tunica externa, which is going to be most superficial. So tunica intima, tunica media, tunica externa. Let's go into what each of these do and what they're composed of. So the tunica intima is going to be the deepest layer, so it's going to be the closest to the lumen. And it's going to be composed of simple squamous epithelium. We call them endothelium. That's the specific name that we give to these. And the endothelium is going to be continuous with the endocardium, and so that inner lining of the heart. And again, like it does in the heart, it's going to actually smooth the inner lining of the blood vessel wall, and it's going to reduce friction and allow blood to flow past easily. Remember that smoothness is going to be important later on when we talk about friction, resistance, and pressure. So having that smooth surface decreases resistance of blood flow. Another important thing that it does is that it causes the blood vessels to constrict and dilate. There is a lot of communication between the cells in the endothelium and communication with the underlying muscles or muscle cells. And so they'll talk to each other, and it'll play an important role in regulating the local blood flow in an area, and will allow for constriction and dilation depending on what the endothelium experiences. So there'll be a lot of crosstalk occurring there. Tunica media is going to be the middle layer, over here shown kind of in red, and this is going to be composed of smooth muscle and elastic tissue. So we can see here we have a lot of smooth muscle here in the artery and here in the vein, and it's going to help, this muscle is going to help give the vessel its shape. Also, in some areas, it can actually be innervated by the autonomic nervous system, and the vessel will be able to constrict and dilate. This is especially helpful in the veins, where the veins will actually constrict and increase blood flow back to the heart to help increase blood pressure. So, but more of that physiology later on. And the other layer, the last layer, is going to be the tunica externa. It's going to be the outermost layer. This is going to be composed of fibrous connective tissue, and this is going to help support and protect the blood vessel, and it also will kind of stitch and attach it to the other tissues of the body. Something that I want you to be aware of is that the vessel walls of the arteries and veins are going to be structurally different, and as a result of that, it's going to allow for them to have different functions. So first and foremost, I want you to look at the structure of the artery. The structure of the artery is going to have a lot more smooth muscle and elastic fibers than the vein. You can see that the vein is going to be much thinner as a result. And because of that, the arteries are going to be thicker. And this thickness is going to be important for the artery's function to act as a way of maintaining pressure, while veins are going to act as a volume reservoir. Because the arteries are going to be thick, and it's going to help maintain its shape, and it's going to help resist stretch, what will happen is when blood goes into the artery, it's not going to expand very much. It's going to kind of keep its shape, and that will help the arteries maintain pressure. That pressure is really important because pressure is what propels blood forward through the circulatory system. And so having a good amount of pressure or a good amount of force is going to allow for that blood to flow through the cardiovascular system and flow to the cells that need the oxygen and the nutrients and all of those sorts of things. So arteries are going to be strong and they're going to maintain pressure. I think of the analogy for an artery like a hose. Hoses are pretty stiff, and as water is going through them, they're not going to expand and balloon very much. They're going to maintain their shape. And you'll feel if you push on a hose, there's a lot of pressure within that hose. And that pressure is what's actually propelling the water out of the hose and moving that water forward. On the flip side, if we look at a vein, so veins are going to carry blood back to the heart. The veins, on the other hand, rather than maintaining pressure, their major job is to actually be a volume reservoir. Most of our blood is going to be stored in our veins. I think it's roughly about 70%, but don't quote me on that. I'm just trying to remember that, the number. So veins, on the other hand, what will happen is they're going to be very stretchy or compliant. So when blood comes into the vein, what will happen is the vein will expand and it will stretch out and it will hold on to that blood. Veins can be stimulated by the autonomic nervous system to contract their muscles, doing venoconstriction, and it will actually push that blood back to the heart. So we can actually control how much blood is being stored in our vein reservoirs. And that can be altered based on the body's needs. So if the body needs more blood going through its arteries, the veins can contract and deliver that blood more to the heart and to the arteries. So the best analogy that I can think of a vein is more like a water balloon. Because that water balloon is going to be rather thin, when it's not filled with water, it's going to collapse. And so that's what the veins will look like when there's no blood in it. It will look rather collapsed, like so. And as it fills with water, that water balloon is going to expand and stretch. And it's going to hold on to that water. However, it's not going to really have that much pressure. If you squeeze the water balloon, you'll see that the fluid will kind of just flow around and not kind of stay, not kind of resist that squeezing pressure that you're adding to it. So Because of the different amount of muscles, arteries are going to act to maintain pressure, and that pressure is going to be essential for moving blood through the body and kind of propelling blood forward, while veins are going to act more as a reservoir. We'll see that veins typically don't have enough pressure to return blood back to the heart on its own. So the veins have to actually get creative and use different mechanisms to generate pressure besides the heart. So we'll get into that in a few more videos. All right. So what I would like you to be able to do is to be able to compare and contrast the three layers of the veins, blood vessels, and arteries, and look at the tunica intima, tunica media, and tunica externa, what they is located in them, how they are different from each other, those sorts of things. All right, well, I'll see you in the next video, and be good to yourselves. Bye-bye.